lot of time talking to individuals. So our grant that we have been truly blessed to receive will provide us with tremendous work, and we're already making new partnerships, we're expanding old partnerships, and we're very, very excited about the service that we are blessed to bring.
And so you do find that the national administration and national situation is much more accommodating to what you're doing now in reference to AIDS than it was many years ago.
Yes, absolutely. The president has signed documentation for the first time in the history of the United States that is targeting HIV. He came up with a national strategy, a national HIV strategy, which is what it is, which helps to lay the foundation for what the White House is looking to at the challenges, how to rectify those challenges, and then also bringing that down on a community level about how the community can get engaged in eliminating and reducing rates of infection.
You know, I'm reminded that for a long time this was an objection that a large number of people had when they said that the United States would require other folks that they gave money to have some kind of an AIDS strategy, but we didn't have an AIDS strategy ourselves. And so what you're now telling us is that we now have an AIDS strategy after all of these
years. We now have an HIV/AIDS national strategy by which will be our blueprint to move the agenda of HIV and AIDS forward. Because again, it's affecting all of us. You know, it's affecting blacks and whites, Hispanics and Asians and Kurdish, and you know, it doesn't care about any of that. And as you know, Nashville has one of the highest population of Hispanics and Kurdish in the state, and so it's impacting all of us. So we're very happy that this administration has moved forward with this national strategy, and within that national strategy has allowed women to be one of the ones to receive these funding to move the state, the White House's agenda forward. So we're
what
pleased.
About trials? Are we still trying to do trials in reference to this? What?
Yeah, there still are many clinical trials, and Vanderbilt University is really on the forefront of a lot of trials, and so I strongly encourage anyone to get in touch with the Vanderbilt clinical trials and the Vanderbilt vaccine unit at Vanderbilt, because they're really doing phenomenal work. So I strongly encourage that. But yes, there still are trials out there, and with those trials, those individuals living with the disease will have access to the medications for free, which will then help themselves as well as help move the clinical trials forward too. So especially women, we need to be engaged and involved in the clinical trials, because I'm sure they are always having a difficult time finding women, but women respond, of course, as you know, differently than men to most things. So getting women engaged in clinical trials is going to be a critical thing, which I strongly encourage.
Now, even though you've got this great grant and you've got a lot of money, but you still need support, let's talk about some of the kind of support that you think that our audience can give you this morning.
I appreciate that. We're always looking for board members. That is one of our critical things that we could always use. We're always looking for advisory people to sit on our advisory panel. But we're also always looking for ways by which to have fundraisers. We're looking for grant writers. We're looking for fund development individuals. We're looking for people to come on board and help us to raise additional funds, because you're right, the grant that we have is so specific and so targeted to certain things, but it doesn't help with housing, which we really, and food and those kinds of things. But you're hard pressed to get me to talk about HIV or talk about domestic violence or talk about anything else when my kids are hungry, or when I'm hungry, or when I'm homeless. So those are the things that we really need people to come alongside and help us to support the community in individuals that are homeless. Our HIV test kits, we need funding to help to support that. We want to broaden and expand our food pantry. So we have these other services that we provide to the community that are not presently funded, that we really need to help to have financial support, so then we can actually implement those interventions that we discussed.
As a final statement, what about the church? Has the church done anything over the last 17 years that would indicate to you that they're ready to face the challenge or deal with the challenge of HIV/AIDS?
The African American church has come along slowly. The African American church has not come along progressively enough, in my opinion. I would love to see more churches, not just African American, but more churches across the board allow people to come in to have conversation about sexually transmitted diseases, about domestic violence, about substance abuse, and about those issues that are actually affecting their congregation. But I would challenge the church. I would challenge the community to allow, give us a call, let us come in and provide services, because they're not doing enough.
Very good. And of course, we're almost at the end of the show for today, and I want to tell you how much I appreciate you coming by and giving us the excellent information that you've given us.
Thank you.
You always do that when you come by and deal with us, but we're certainly delighted to have you here with us today.
Thank you.
And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you, and